So in Uganda, sadly, about 350 children die every 2 days of pneumonia, diarrhea and malaria. And if they're not vaccinated and they can't access health services, that number will increase. Nearly no children die of COVID, but their parents do. So to protect the whole of society, we need to maintain health services for all disease outbreaks and all health conditions.
When like 1 or 2 of us were confirmed with corona, now that one was worse. None of them wanted really like to access the health center here. So they were delivering home. The children were missing that immunization schedule. They were really not coming. That thing had a negative impact on our services here.
We need to focus on immunization for diseases that cause death, needless death, for both children and for parents. UNICEF does this through procuring all the vaccines on behalf of the government of Uganda, funded by Gavi. And also we strengthen the cold chain, and we're so proud to say that every district and every health facility now has either a freezer or a fridge, depending on the vaccine needs for storage. We are still looking for funding for vaccine carriers to enable campaigns, but the underlying cold chain is now quite robust and solar driven, so also using renewable energy.
Since they started giving them the vaccine, they have started coming for the health service, and then there's our own fellow staff who were positive. They were managed, and right now they are okay. So we also told them this thing can be treated when it's detected early.
A very important vulnerable group of concern to UNICEF and the government of Uganda are that of pregnant women. 343 per 100,000 women die in childbirth, and they're much more likely to die if they have COVID or an underlying disease like malaria or pneumonia. Their newborn babies obviously die as well. 27,000 newborns die a year, which is a very high figure for any country. So we especially emphasize the importance of vaccinating pregnant women for COVID and for other diseases during outbreaks.